everyone. My name is Dr. Michael Hirsh, and I'm welcoming you to another edition of Worcester District Medical Society's Health Matters cable access medical information show, sponsored in part by WCCA TV, channel 194. Today we have a really stellar group of guests. I'll start with Dr. Jill Terrien, who is Associate Dean of the Graduate School of Nursing, and a wonderful advocate for interdisciplinary training of nurses and doctors together. Those divisions are going away because of her efforts, and we're very grateful she could come. Thank you, Jill.
Thank you, Dr. Hirsh.
And here on my right is the esteemed Chancellor of the University of Massachusetts Medical School, which some of you know is 3 schools in one, and I'll let him talk a little bit more about that himself. Dr. Michael Collins, such a pleasure to have you here, a real honor. And I was just saying to Jill, to spend a half an hour with you, you're kind of a forced captive here, but it's really exciting for me. So I thank you both for being here. So, we're filming this just about the 1-year anniversary of the COVID pandemic being declared a national emergency. And I wanted to have you on because I thought it was important for us to talk a little bit about how we pivoted from being on defense all the time to getting on the offense with the vaccination program. And that's something I will talk quite a bit with Jill about. And for Dr. Collins, I wanted to make sure that we got a real great overview from, the kind of vision that you have about medicine, about the medical school, about medical training, that will kind of put this in some kind of perspective, because it's been such an incredible, in some ways tragedy, in some ways triumph of medicine and how the country has been affected. So I hope that will fit into your ideas about what we're going to talk about today. We've all been vaccinated, so I think it's all okay for us to take off our masks as per the CDC's guidance. So thank you all for being here. So let me start with you, Jill. I know we had conversations in April of last year about how we were going to have to fight back once we could against this virus. And, your mind just goes a mile a minute. And sure enough, we kind of fleshed out the idea of rehashing an old technique that we used to fight some of the other viruses and pandemics that the city has faced over the years. So tell us a little about that.
Yes, well, I'm remembering. It's hard to believe it's a year, and just so grateful that we are on the offense and that we're able to, work through this in such a great, a great time for our students and hopefully for our nation getting better. We had a call. We talked about intramuscular injection training that we had done several years ago. And we had trained the medical students, usually in the 3rd year of their program. And that had run, I'm going to say, almost 10 years, I want to say. And then, for reasons I don't remember, it wasn't my baby back then. I was loosely involved. It was involved with one of my courses. We didn't continue it. And you reminded me of it. And then I thought of the group of students that were going to be in my class in the fall, and that we usually need, we call it community service learning and population health practicum, and that this could fit. And so what we did is work to resurrect and put the latest evidence into a module for the UMass Medical School medical students. And that was and we made a pre-test and a post-test, and we kind of packaged it, and we worked with you, and we worked with medical student Christopher Lee, who is an unbelievable partner. And then he introduced us to or me at the time, to the Student Crisis Emergency and Preparedness Committee. And I'm now a faculty member working with that group of a tri-school community, which is really great. So that's how it came about, is that, we had that conversation back in April, and the students, and then the fall, we know how the fall was. We were waiting, hoping for the vaccine. And you were pretty confident that we were going to probably have it early 2021, and that we wanted our students ready. So that's the initial story of where we are. That's how we landed where we are today, and it's grown. We know that. So,
well, you're being very modest in that. We did have that anticipated vaccine arrival in January, and you 2 days before the vaccine arrived did our first batch of trainings until we had almost 750 people trained up, and like I was saying before, you've been so involved with the different aspects of interdisciplinary training, and to see the graduate nursing students be the mentors and the teachers for these students, it was such a heartwarming thing. And I think it is going to be kind of a metaphor for how training is going to go in the future. We all have skill sets, we all have expertise that we can share with one another, and there's no hierarchy anymore. It seems like everyone's on the same team, and especially in fighting COVID, we really had to leave all our affiliations, all our egos at the door and just all pitch in, and that's what this has been like. And a lot of that's just on you, and everybody is so appreciative. I know we were able at the Department of Public Health to finance a little bit of the supplies that you needed, but you were just launched on your own pretty much,
Well, you give me a lot of credit. It is truly the team effort. It's, UMass Medical School. I mean, when anybody heard we were doing it, and the city of Worcester, with the supplies, it was an all-in effort. And I think that people were very happy to do it because it was, like you say, on the offense rather than the defense, and very hopeful. I mean, people miss their families, they miss their gatherings, and, we do what we have to stay safe, but it's nice to know that that is coming soon as we vaccinate and, continue our great public health measures to keep everybody safe.
Yeah, it's been very successful, and Chancellor Collins took it to a next level, because once he heard that he had this army, he got a swag, you see. And
I forgot to wear my vest, but I have the blue on.
But Chancellor, I was going to just ask you, hearing about this model and also just understanding how much collaboration has gone into our response as a community between the city and the medical school and the medical centers and the family health center and the EMK center. I mean, we've had an unusual collaboration going on. And do you see it continuing, or is this just like, will you still love me tomorrow? I don't know, one of those one and done things once the pandemic hopefully fades into the past?
Well, first let me say, Dr. Hirsh, what a pleasure it is to be with you, and let me thank you for your leadership and your thoughtfulness throughout the course of the year. So many of us have looked to you for your direction and your thoughts. I actually think Worcester is a very special place. I think I've said for years that we have a collaborative gene here, and it's fully expressed. And my expectation is that the collaboration we've all experienced this past year will continue. It was an extraordinary moment just a year ago. I was just finishing a very long trip and had been having conversations throughout the week about the impact of COVID on the medical school, on our community, on the Commonwealth, and frankly on the university at large. And there were many conversations about, I remember the first ones about, well, would we have to go to remote learning, or could we depopulate the campus, or how would we actually continue to care for the patients? It was just a year ago. And if you think of the extraordinary things that have happened over the course of that year, we were able to on a dime, pivot education from something that was done in a classroom to something that's done remotely. We were able to turn down the activity in some of our labs and ramp up the activity in others of our labs, where 19 of our labs pivoted literally in the course of a week from doing whatever research they were doing to now full-time COVID research. We were able to be the first medical school to graduate its medical school class, so that our graduates, some of the most highly trained and professional doctors, could go right to work at the DCU Center Field Hospital, and how important it was to Dr. Dixon and his colleagues, who were working so hard in the clinical setting, to have this whole group of young, well-trained practitioners be able to go right to work to care for the patients as they were coming into the DCU Center. We then were able to think about, with some time, how we would be able to test folks, and we were one of the first universities to come back, where by creating a testing program and did that from scratch in partnership with the Broad, which was really wonderful. So all of us, even today, today's the day I'm tested. I'm tested once a week, and it's allowed us to have an environment that's safe. And then we brought back all our labs, and then we brought back all our students. We were able to close the field hospital before we had to reopen it again with the second surge. So it's really been an extraordinary time. In a way, it's like a bad snowstorm, where we kind of all come together, and you help your neighbor, you shovel their walk, and you maybe have to cook them a meal if they lose power, or let them come over and use your shower if you're lucky enough to have water and they don't. And I really do think that neighborliness, that collaborative spirit will continue into the future, certainly among the healthcare community. What Dr. Terrien and her colleagues in our nursing school, they help us to foster an interprofessional spirit, which is unusual among American higher healthcare education. And frankly, our learners, as they come to our schools now, whether it's our nursing school, our medical school, or our graduate school, they want to work together. Their style of learning is different than ours was. They learn better through group sessions. They appreciate the ability to care, to have the patient be the center of their learning experience, and not a practitioner. And so I think many of those attributes will perdure long into the future.
So in thinking about the present and then, of course, the future, do you think that the other things that happened in this past year, like the revelations about health disparities and how the pandemic really kind of heightened our awareness of them, along with some of the other horrific social justice challenges that we had during the year, are going to change the way our medical community works, lives, learns in the future?
Well, I certainly hope so. The reality is that we've known for years that there is great disparity. There is great inequity. I like to use the analogy of a bicycle. We can say that we're going to give 4 people a bicycle: a 6'4" man, a 5'2" woman, a 12-year-old child, and a person who has lost the use of their lower extremities. Needs one of those bikes with the hand thing. Now, if we give all 4 people the same bike, we can say they have a bike. But if you gave a child's bike to the 6'2" guy, it's not going to work. If you give the bike that the 6'2" person needs to the woman, she's going to be very high, way up on the chair to be able to drive it. And certainly if you give a bike with 2 wheels and handlebars to the person who's disabled, they're never going to be able to drive the bike. But if you give the guy a bike with a tall seat and high handlebars, you give a woman's bike with, probably a child gets a child's bike, and the disabled person gets a bike, then now you have equity. And I think what we learned, what we've learned in the pandemic, or the experience that's been, in front of us during the pandemic, is that we have to do a lot more about inequity. We're going to have to do a lot more about access. We're going to have to work, we're going to have to find ways to bring care to the patients most in need. Because it's one thing to say you have health insurance, but if you can't get vaccinated, what good is it? It's one thing to say that, that we sit in the midst of marvelous healthcare institutions, but you have no way to get out of your house to get there. And we have a whole group of people at the medical school who study healthcare inequity and disparity, who have worked, and it was very interesting because as we completed the strategic plan, which we've now begun implementation of it, we had a major thrust in that plan around addressing healthcare disparities and inequity. And what the pandemic did was, if you will, it would jumpstart those efforts because it brought right to the fore all of the challenges. We can say we have vaccine, but if you've got to go to Fenway Park to get it, you may never have it. And if you're a person who's homebound and we can't deliver that vaccine to your house, then what good is it? If you can't get an appointment on a website because you don't have a computer or you can't see your iPhone, what good is it? And that's sort of been a wake-up call for all of us, that we have to have these mediating influences now put in place so that we can actually make equity mean equity. And I do believe that that so many now are focusing on this that it's quite likely that we'll do a much better job into the future.
Jill, you have a wonderful core of graduate nursing students. I've met so many of them who have been the vaccinator trainers, and then and they're from all walks of life, and they've decided to. Some of them go directly through nursing school to grad nursing school. Some are changing careers. Have you noticed a different focus, a different sense of service ethic in them? And how do you cultivate that?
That's interesting. So, Dr. Collins, as you were talking about how we were educated differently in our time, I think what I see is that our students, they've always taught us, but I've noticed over the years, which means, I've been around a while, that this is a different group. Their social justice aims, their understanding of the social determinants of health is incredible. The course that I teach, that this vaccinator group is attached to, is based on population health, social determinants of health. We talk about the healthcare disparities, the inequities. And I used to see that when the students came in, there was a lot of learning going on. Now there's a lot of sharing and a lot of teaching from them to us. And their understanding is a lot deeper than I've seen in the past. And with that, you see a lot of things happen. As Dr. Collins said, you see the students, they want to be together, they want to learn together, and they really elevate us as a school, as teaching faculty. As you talk about pivoting from, face-to-face learning to, being a Zoom classroom is really not anything I really imagined myself doing. And now here we are a year later, been doing it quite successfully, and with some really good outcomes. And so the other thing I wanted to say is, the other thing I think that's going to come out of the pandemic is the telehealth. That's probably here to stay. And as a matter of fact, my former alums and the faculty I work with through a grant I have saw their visits of those with healthcare disparities increase with the use of telehealth, because they didn't have to get transported. I mean, telehealth isn't for every visit, but they saw an increase in their visits, which was really quite good. The other thing is, I just have to say, the nursing students I'm working with, the medical students, and the GSBS students I'm working with really are the main show. This weekend we took our show. We were asked to train the BU train with them, and we went to the Boston University campus Sunday And we helped work with them to train 124 medical, PA, and dental students in giving injections. And they're going to probably take that, and they're going to continue on and finish with the rest of the people that they want to train. And this was all because of relationships that UMass Medical School has, in that community, and the sharing. So I think the sharing, the hope, and just the really good feeling you get from helping people that are going to get vaccines in arms is really gratifying, really gratifying.
Our students come with a certain idealism, which is infectious. And there's a very heightened expectation that the students are going to be of the community. They're going to be in the community. They're really going to be for the community. That is sort of imbued in their spirit when they come to the medical school. Each one of our three schools, whether it's the nursing school, the grad school, or the medical school, this generation of students comes with that expectation. And what the pandemic has done has provided a medium for their actions. And that idealism is really pretty spectacular. When students who could have been traveling anywhere around the world say, no, I'll go right to work at the DCU Center, because why am I sitting home watching ESPN or CNN when I could be making a contribution? And students now who are taking a Sunday or Monday or Tuesday or Wednesday or Thursday or Friday or Saturday and are vaccinating people all over the Commonwealth, that's really pretty spectacular. I actually believe that, this is a time for national purpose, if you think about it. And our students have embraced that, and now are coming together in a very concerted fashion and kind of pushing us to help them to do it, to say, find us a way so that we can make a meaningful contribution now. Don't wait until we graduate. Don't wait till we're done with our residency. Don't wait till my fellowship is completed. I want to contribute now. And that is really pretty spectacular. And I don't believe that's going to go away once the pandemic is done.
It's very, very heartening to hear that, the students, and I've always found over the years that I've been affiliated with the medical school that they always taught up, but now it's really getting actuated in a way that makes them all feel very fulfilled and makes our teachers feel like we have renewed purpose, because they obviously get what the situation is, So, a year has passed. Over 400 people from the city of Worcester alone have died. It's in the two hospital systems. That number is closer to 700. And I certainly want to pay my respects to any of the viewers who have had any lost loved ones. I just wanted to get your kind of final thoughts as we kind of wind down today about what personally the pandemic has meant to you, and what, if any, changes in your future approach to your position or your personal life it's going to mean. So, you want to take a stab at that, Professor Terrien?
Yes, I will. I've had some profound thoughts because the pandemic slowed things down. You almost felt like your life was suspended, and you spent a lot more time at home than I can remember, even from maternity leaves when I had my children. The other thing is, my two adult children still live at home. One's getting ready to go back for another degree, and we spent a lot of time together as a family. And for that, I'm very thankful. I do feel horrible about the families that have been affected by death from COVID, and my heart goes out to them. I think that what we're seeing with what our students are doing, that the new norm, this is a new norm of this volunteerism, this activism. It's exciting to know that we have such resources around us. And I want to thank all of my nursing students, my faculty, the faculty at the Medical School, and Dr. Collins for your support of all our endeavors that have gone forward in this. And Dr. Hirsh, you're a catalyst. You were part of this, and the Department of Health and Human Services in the City of Worcester, we all partnered together, and it was really great. So that, I just want to thank you for allowing me to be in the presence of two just great people. This is really a great night.
Thank you, that's very kind. I'll say a few things I have felt have been reinforced by the pandemic. I think we've learned as a nation the importance of commitment to public health. If you think of the trillions of dollars we've now spent trying to get our economy back started, if we had spent a few billion in assuring that a nation as large and as competent as ours had a well-functioning public health system, we would be in a much better shape than we are today. That's a lesson for tomorrow, and one that I think we need to take forward. I think we've learned the importance of family, the importance of colleagues. We've learned the importance of the privilege that we're given as professionals to care for those most in need. I've never been prouder to be a physician. I've never been prouder of our profession. We had people stand in the most incredibly selfless ways in harm's way. And lastly, I think we've learned ever more each day how important it is for each caregiver to hold the hands of their patients. Because we've learned in the course of this past year how difficult it is when we haven't been able to do that.
What can I say? This is an extraordinary show for me to be in the presence of these two wonderful people who've given so much to the medical community and to the community at large. So I just want to close by saying thank you for watching. You'll pick this up on channel 194, WCCA TV. It'll also be archived on www.wdms.org. And come back and watch us another time on Health Matters. Thank you, Dr. Collins. Thank you, Dr. Terrien. You certainly made my week.
Thank you.